Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me today are some folks from the Lift Therapy Center in downtown Jackson. I've got Eddie Sidwell, Jeff Johnson, and Suzy Smith. How are y'all today?
Doing great.
Doing good.
Good. Thanks for coming in. So today we really just wanted to take 20 or so minutes to talk about what you guys do. I know, Eddie, you're a physical therapist. Jeff, you're a speech therapist. And Suzy, you're an OTR/L. I don't entirely understand what those mean, but I'm sure you'll dive into it and kind of let everyone know. So we'll just have everyone just kind of say what their specialty is, and we'll go from there. Eddie, we'll start with you.
Working outpatient with patients that come in. I typically work with patients with neurological deficits.
Okay.
Which would involve strokes, brain injuries, Parkinson's, and several other areas, I guess.
Okay. That's awesome. Jeff, what about you?
I'm the speech therapist, and like Eddie, we're part of a Neuro Team. We're a team. We need to come up with a T-shirt. But we do treat those that have some type of brain injury, brain insult. And similarly, we work primarily, the majority of all the patients that we see to treat for neurological problems are stroke patients.
Okay.
And then, as Eddie said, brain injury, could be brain tumors, could even be concussions that we might see patients for.
So you guys would potentially see patients who are, like, say, in a high school football team?
Yep.
Gotcha. Okay. And then, Suzy, what about you?
As an occupational therapist, my job is coordinating with Eddie and Jeff on the best plan to get our patients back to their highest level of function.
Okay.
Focusing on just everyday activities, anything that they're involved in recreationally or just things around the house, hobbies that they're used to doing. We're just trying to get them back to a level to where they can be as independent as possible and function in the community.
That's great. You guys kind of alluded to it a minute ago, but can you guys tell me the difference between occupational therapy and physical therapy and speech therapy? As a layperson who's never really been around this world of physical therapy and occupational therapy, I really don't know the difference between the three, so I'm sure other people don't as well.
I think that's a question a lot of people ask us. There's a lot of gray areas where we overlap. As an occupational therapist, my main function, like I said before, is to work on getting them to be able to care for themselves, focusing on dressing skills, bathing skills, feeding themselves, just basic grooming, taking care of their home, laundry management, washing dishes, being able to do yard work. And then as far as just the physical aspect, a lot of times I'll focus more on just the upper extremity function.
Okay.
Just the shoulder, elbow, wrist, and hand, and how it coordinates in with those self-care activities.
Okay. And what about PT?
As a PT, the good part about having OT in the same building is I don't have to focus on everything, so I can really focus in on mobility. I'm looking at walking, leg strength, balance, any kind of activities where the person is we're trying to get them more independent and moving around in their home and their community, whether that's walking or with a cane or a walker or hopefully without anything.
That's great. And then for speech therapy, I've done a podcast with some people from Sports Plus and Dyersburg about like swallow therapy. Is that something you do as well?
It is.
Gotcha.
As a speech therapist, what I target are the language skills, make sure that they can communicate effectively and that they comprehend communication effectively. And if they have some impairment with their communication, if they have difficulty saying the words or thinking of the words, or their speech is so slurred, sometimes we get involved by helping them obtain a talking computer that can help them communicate. But we also work with patients who are having swallow problems after their brain insult, who also have difficulty with many of their thinking skills. I know there's some overlap between what OT and what I will do, but I would say half the stroke patients that I work with are not so much speech or language impaired, but they do have some cognitive, some mental impairment that is impacting their life. And so we jump in and help them with that.
Yeah, that's great.
where they deal with the physical deficits of impairment after the stroke or the brain injury, that I come in with the communication, cognitive impairments, swallow impairments.
So how long have you guys been practicing?
A long, long time. I was just telling them this week that this is going to be my 30th year with
Congrats.
Big Blue,
Yeah.
with Tennessee Healthcare. But I've been practicing for a little over 31 years.
Wow, that's amazing.
I've been going on 28 years, and all of them was West Tennessee Healthcare. So I started in '93.
Man, you're old.
I know.
I graduated from UT Health Science Center in '97 and started with West Tennessee Healthcare the same year. So in October, it'll be 23 years here with West Tennessee Healthcare.
So it's safe to say you guys are all three hometown folks. Been here for a while.
Yes,
Know,
yes.
for sure know what you're
Yes,
doing. That's
been
great.
Born and
grew up
raised.
here.
Yeah, that's awesome. So you guys, I know you alluded to seeing stroke patients. So what all kind of patients do you see? Is it just stroke, or is there a vast type of patients you'll see?
Well, I know really any patient with some type of neurological insult. So stroke would probably be the major diagnosis, I would say, but we run anywhere from, brain injuries. We have a lot of people with Parkinson's that we have started seeing. Jeff and I have been certified in a Parkinson's treatment. And then any other MS, we will get some patients with that.
We have spinal cord
Spinal
injury
cord injuries.
patients.
Okay.
We have patients who have like glioblastomas from some type of brain cancer. Really, the challenging thing about lift therapy that really keeps us on our toes is we never know if anything that's neurologically involved. We pretty much treat that. We don't turn away anybody because we feel confident with our years of service that
Sure.
we're going to be able to provide them the care they need.
Yeah, that's amazing. So to kind of
But we have such a diversity of experiences in different settings that sort of make our skill sets unique, because it has not just been in the outpatient setting. I know, Suzy, you've worked in many different settings.
I have. I started out with West Tennessee Healthcare in acute care, and then I was in the school system some with a grant through the health department. And then I worked inpatient rehab for about 5 years.
Okay.
And then I came to outpatient about 18 years ago. And on top of that, kind of on the side, PRN work on the weekends, I would go to some skilled nursing facilities or do some home health. So
wow.
I pretty much worked in any setting, so I feel comfortable with whatever the patient's needs are.
Yeah, that's great. Obviously, you guys have a lot of years together in your field. Technology is just evolving, as we go. So what kind of technology do you guys use or equipment that helps you in addition to your years of service?
Well, at the lift, we do have a couple of pieces of equipment that we'll use for not only neurological patients, but other patients. But the Alter G treadmill is one that we can put somebody in a treadmill and kind of eliminate some of their body weight to make walking easier, to where
Okay.
we can simulate that a little bit better. We have just recently started using RT300, which is a bike, upper extremity bike and a lower extremity bike at the same time,
Oh, wow, okay.
with electrical stimulation to assist. And that's more for neurologically involved patients that we have, Suzy and I have kind of started using over the past, I'd say, 2 months, with some good results so far.
Yeah,
And,
that's
so
great.
It's very promising.
I think that, we have several iPads around the clinic, and especially with our younger patients, there's a lot of apps out there
Sure.
that can help with all different kinds of, visual activities, fine motor coordination, gross motor coordination, just sequencing daily activities. So it's become very beneficial just to recommend some different apps for them to use at home to just continue to work on things when they're not with us in the clinic.
Yeah, that's cool. And most people at home are going to have a phone or an iPad or something like that they can use that on. That's great.
And along that same lines, there are a lot of new apps that help with speech language exercises, with either articulation or with comprehension of language, that have become very helpful for my clients when they go home. And we are all big believers in homework, right?
Have to do it.
What you do at home. And they really got to work their tail off while they're with us.
Yeah. I've done several podcasts with like Brian Thorne and Andy Aiken, and they all basically said therapy happens, yes, in the clinic, but it happens at home when you're doing the exercises we give you.
Yeah,
So
we say that all the time. I mean, we get you for maybe 3 hours a week in
Right.
each session, and so there's so much more time that you're at home, and that's where you're going to make your progress a lot if you
Right.
can carry over what we're doing. So
yeah. So what kind of specializations do you guys have?
I'm certified in using an orthosis called the SABO. What it does is allows the patient to do repetitive motion, just trying to relearn how to use the upper extremity they'll be fitted with it. It's a customized fit.
Okay.
A lot of patients have trouble like opening their hand or straightening their elbow, and it has a spring-loaded device and tension cords that help with that part.
Oh, wow.
So that allows them to be able to reach forward, grab things, and put them in different positions just like you would use it on a normal everyday basis. Just some help with the spring-loaded device on the orthosis.
Gotcha. So is that something that patients would use while they're in the clinic, or is that like you'll have this out on loan for like the week and you can work over that home?
The good thing about SABO, it offers a free 30-day trial to see if the patient will truly benefit from it.
Okay.
And so we'll do a 30-day free trial, and if they've done really well with it, then they'll get their own customized, either if the insurance pays for it or out of pocket. But it's something that I fit them with. It comes in a little bag. They take it home, work on what I ask them to, then they bring it back to the clinic, and I might add in some new exercises at that point. So
That's awesome.
it's something they're working on. The recommendation is 2 45-minute sessions every single day.
Wow. Okay.
So it's pretty intense. So not everybody's a candidate for it,
Sure.
but that's a good thing about that 30-day trial period.
Eddie, what about you?
I am certified in LSVT Big, which is a treatment for Parkinson's patients. Have been certified for 5 years now. And it's an outpatient treatment that we carry out, pretty intense, 4 days a week generally, if the patient can get there, really focusing on improving their movements, their amplitude as far as the way that they move, and improving their balance and hopefully helping them walk better. With Parkinson's, it is generally progressing, and so we see them at all different stages. Usually, if we catch somebody with an early diagnosis, very good results with this program where they can kind of carry this on and at least establish an exercise routine.
Yeah,
So,
that's great.
it's been good.
And Jeff, what about you?
Well, similarly like Eddie, I'm also LSVT Loud certified, and we often, whenever we get a Parkinson's patient, they will be sent to both PT and to me for the Big and Loud program, because that's something that's a very common symptom with Parkinson's. As there is a physical deterioration in their movements, there's also a deterioration in how they talk. And it usually, classically, it just gets quieter and quieter and quieter. And so what we found with Parkinson's patient is that through this intensive 4-week program is that although we cannot change the progression of Parkinson's, what we can do, we can change their response to the symptoms.
Okay.
Whereas they are capable of.
Sometimes when they come in, they're just not aware that their symptoms have progressed to where they are. They don't realize their voice is not as loud as it was a year ago or 2 years ago, or they don't realize that they're shuffling their feet when they walk. Sometimes they just say, this is just the way I walk.
Right.
I think it's because I'm getting older, and it's really not. It's because of the disease process.
Okay.
And so sometimes just making them more aware through the treatments, they are able to counteract those symptoms. So they overcome it and know that, okay, I'm not supposed to talk like this, or I'm not supposed to move like this. I can move better and I can talk better. And you see a lot of good results with that once they're aware of that.
Yeah, that's great. So just to make sure I understand it correctly, LSVT Big focuses on the physical movement and the Loud focuses on speech. Is that correct?
That's correct.
Yes.
Gotcha. So you guys say you see neuro patients. Can you give me like a definition of what a neuro patient would be?
I would say just anybody with what we call a neurological impairment, and that is usually involves the brain or the spinal cord.
Okay.
So any kind of insult or injury to the brain, which, classic traumatic brain injury, car wreck,
Four-wheeler
concussion,
wreck,
four-wheeler wreck, we've seen it all.
Gunshot wounds.
Seen that too, or an injury to the spinal cord that could happen in any numerous, ways. And then you got your stroke, insults, and then some other disease processes like we talked about, Parkinson's, maybe MS. Some other ones that maybe not so common, like Guillain-Barré, which we used to see quite a bit. I haven't seen many recently, but there's a lot of other maybe what you would call rare neurological problems that we may come in contact with.
Okay. So why is it important to have a neuro team that works together in the same facility?
A lot of our patients have deficits in several different areas, and it requires each of us to get that patient back to their full function. And I think, too, we can just feed off each other and make sure that all the problems they're having are addressed at one place and that they can return to their best level of function every day.
I'm not going to say quick stop shop, but it's like a one stop for everything kind of.
Right, and a lot of those patients are leaving an inpatient rehab facility where they've been receiving all 3 services, and the physician wants them to continue that because that's in their best interest for their full recovery.
Yeah. Obviously, you have a lot of years between you individually as well, but what do you guys offer that many other therapy clinics don't?
I would say it's the continuity of working together for so long in the same place.
Mhm.
So we're talking with each other between, patient visits, seeing how they're doing with speech therapy or with OT. I say, well, they're doing great with me walking. Well, they're not doing as well with the speech because of a visual deficit or because something else is going on that I may not have even picked up on as much with what I'm doing. And I just think the fact that we can do all that in the same facility just provides better care for the patient. They don't have to go to PT in one clinic and then not get OT, or get OT at a different clinic only one time a week because they can't fit it into their schedule.
Right.
So we usually schedule our patients, like if you have all 3 disciplines, you're going to be there from, say, 9 in the morning to 12, and you'll get an hour of each one of us.
Oh, I got you. That's
And
great.
So we try to make it easy on the patient to try to, because it's tough on the patient and the family when they're going through a
Sure.
process like that.
And I think another benefit of having a team, an experienced team, is that we have the perspective of having treated hundreds and hundreds of patients through the years. We have sort of a long-range view of what can be expected and what we can tell the families and the patient.
One of the nice things about having them in the clinic is I want to try to progress them to something that I'm not sure they're able to do safely. I can come to Eddie and say, does this patient have enough balance to be able to unload the dishwasher or get in the shower? And that way, things that I'm not real confident that they're able to do safely, I can ask Eddie or I can ask Jeff, hey, is this patient ready to do his own medicine management, or is he ready to do financial management at home? And he's worked with them for hours on things like that. And that allows me to say, hey, let's progress to doing this because I know that we can do it safely, and I feel like that you would be successful at it.
Gotcha. That's great. So obviously 2020 and 2021 have been, we don't have to say shaken by COVID, but we'll mention that for a second. So I guess what precautions are you guys taking to help ensure that people feel safe when they come see you guys?
With our facility, every patient that comes in gets a temperature check as soon as they come in. When they are being treated, everybody has a mask on within the clinic. We are keeping the distance between the patients, trying as best we can.
Sure.
And for our neurologically involved patients, we do have a bigger room, which that has a little bit more area into, that we can get them in there, big enough to actually have a family member come with them, and they can sit in there with them to kind of keep them away from some other patients if necessary.
Sure.
Yeah, we're encouraging them to use Germ-X when they come in and when they leave, and any piece of equipment that they touch, we're following up, wiping it down between patients. And then as employees, we have to check our temperature when we come in, and then again after lunch, and keep that on a log just to make sure that everybody's practicing safety.
That's great. So I've done several podcasts with different people from Sports Plus and Live Therapy, and all of them participate in what's called direct access. I'm sure that term is not a new term for you guys. So I guess my question is direct access something that your neuro patients can utilize, or is that something that they have to be referred to by the neurosurgeon or neuro doctor?
I would say, yes, they can use that. I would say typically most of the patients we get have been in the system, and so we're getting a referral from a doctor.
Gotcha. Okay.
But if we have somebody that has had, say, a CVA 2 years ago, and they developed some type of, their gait has changed, and they wanted just somebody to take a look at them to do an evaluation, they can come in through direct access.
Okay.
I think
Can
only
they
PTs can do direct access.
only
OT and speech do not have direct
that needs
access,
to be
only PT
clarified.
at this point.
Yeah,
Okay.
that's okay.
But
Yeah.
if they come in direct access through him and he's like, hey, they really need OT or speech, we have no trouble writing a script, sending it to the doctor, and the doctor usually has no trouble signing it. They're usually familiar with the patient and know their needs, so we hardly ever get refusal on that because the physicians, especially with our experience, trust us and our judgments on what the patient needs, and so it's usually not a problem getting a prescription for them to come and see us.
Okay.
And that makes me think of another benefit. You touched on this and why the benefit of a neuro team of having all 3 disciplines, PT, OT, speech, working in the same facility, is that often if I'm treating a patient and they may not be seeing PT or OT, that I will go ask one of them. They can either come into my office and just do a quick eval, quick assessment. They can talk to the patient and then see if they need a referral to OT, PT. It's just that quick. And so because of the years we have of working with each other and feel very comfortable just with the questions that we have, just benefits the patient.
Yeah.
Yeah, we have patients traveling over an hour away just to come see us because it's very rare to find all three disciplines in the same clinic.
So what are the many different therapy settings that you guys have worked in and your experiences in those?
I started off working in a physician's clinic for a couple of years, and in that clinic I saw small kids up to grandmas. I saw everything. Then I transferred here to Jackson, worked in the inpatient rehab. That's back when Dr. Satterfield was the head of that. Worked there for 4 years, then went to skilled nursing just down the road for 10 years, and have been at outpatient rehab connected with the Sports Plus. We've been at lift therapy for 7 years. So I've had a mixture of a lot of different settings.
Yeah, I started in the hospital, Jackson General. Within 6 months, I found myself on the inpatient rehab floor, working with Dr. Kerwin, who is still practicing and is really handles a lot of our neurologically involved patients. So was there for 6 years and spent a lot of time on the brain injury team a day, and in that setting is 4 or 5 brain injury patients. You're just seeing them working on inpatient rehab, intensive therapy. A few years after that, ended up in a skilled nursing facility for a few years, and then back to inpatient rehab, and then shortly after that to outpatient rehab, basically with a neuro emphasis, I guess, in outpatient rehab.
Yeah, and you guys are all down at lift therapy in downtown Jackson, which I think it's amazing that all three are offered in one location. You kind of alluded to it, but like a patient, if they have issues with all three, they can be there from 9 to noon, knock it out all at one time, as opposed to having to go on Tuesday to one location, on Friday having to go to the next for something else, and then the following week for something else. So I think it's great that it's all in one thing. So what are some of the most challenging aspects that you guys all see working with neuro patients?
For me, I would say the most challenging thing is you're working with a patient, but you're also working with a family. And the majority of the time, it is a life-changing event that has occurred. Most people with a significant neurological insult are not going to get 100% recovery. So their life has changed, which has changed their interaction with their family and vice versa. And so I think the challenging part is just walking them through that process and trying to be there for them and just love on them while they're here, because it's a tough situation for all involved.
One thing I've learned about people that work down at Lyft or Sports Plus, that there's much more of a family approach to the therapy you guys are providing, as opposed to just, all right, this person's here, let's check them out, get them out the door. Everyone that I've talked to and everyone that I've seen is always, you can see their heart for their patients, and you guys really truly do care about everyone that you see.
I just think adjusting to their new, quote, normal life, a lot of them are in denial in the beginning of what normal's going to be.
Sure.
And that's hard for them to swallow, and us too. But we have to help them adjust to that and teach them that, hey, they might not can do this, but we can do this instead and still live a functional life. And I think a lot of them have been through, acute, they've been through inpatient, they've been through home health, and we're kind of like the end of the line. Like when they get done with us, we might see them on out months or years down the road, but that's kind of like, this is my life now.
Right.
And that's kind of something hard to accept.
Sure.
And so I think involving the family and just showing them, hey, they can do this. They don't have to do it like they did it before, but we're going to show you a way to do it where they can be more independent and make everybody's lives easier and more enjoyable.
I think they both really hit on it. I wouldn't have stated that as some of the most difficult, but really it is all that emotional heft that comes with it.
Sure.
And as Suzy said, that their life is forever changed. And so they're dealing with that, the family's dealing with that, and then on top of that emotional weight that they're carrying, they have a lot of physical adjustments to make. And I know personally, no offense against OT-PT, but with the deficits caused by a stroke, but if a person's ability to communicate is knocked out, their level of frustration goes through the roof. And then finding a way for them to just communicate their basic needs and their thoughts and to be understood. Very common after a stroke, these patients say that they feel stupid, they feel dumb because they're not able to communicate like they used to. They do feel incredibly less as a person.
Sure.
And their value in what they can contribute. And we continue to help them see that they can do quite a bit and they can contribute. And what I preach to them is that they are not stupid, that they're still smart. And when I tell them that they are still smart, many of them at that moment, their eyes just well up with tears because they feel so diminished. They have trouble with words. They have trouble with language, but they're still able to think and feel. They're still the same person.
Right.
They just don't have the same way to express it.
You guys mentioned the most challenging parts of working with neuro patients. Talk to me about some of the most rewarding aspects of it.
To see a patient finish up with us on discharge day and being able to do so much more than they were when they walked in the door. And it changes just their whole personality and their whole outlook, you know, not having to depend on somebody to get you dressed or bathe you. I mean, that's a big deal because that's something that's embarrassing. Nobody wants somebody to do that for them. And just to see their look on their face when they're able to accomplish things that they never thought they could do is just very rewarding. I mean, I think even though we talked about the negative aspect of the new normal, I think there's way, way more positives in treating neuro patients because we just see so much improvements and them returning to their quality of life. They're so very thankful to us, and I think that's the part that just keeps us going every day.
Eddie, what about you?
I would say the rewarding part is the challenging part. You get to see them succeed with even the smallest task, and it makes such a big difference. Just being able to get in and out of a chair by yourself. That, a lot of times we get somebody that, for 3 months they couldn't do that, and all of a sudden now they can do that. Well, that just opens up the door. Now I can get around my own home, and so now they get that feeling of independence. I think just seeing that, and then just getting people where they're back into at least some type of routine and daily life where they're happy and they're independent.
That's great. And
also, I think another thing is just meeting the different families and the patients. It's really lifelong relationship there that you can see them 5 years down the road, and they still come up and hug on you, and I still come up and hug on them. You get really close to your patients.
Yeah. Jeff, what about you?
One of the most rewarding is when they come back. And we do have patients and families that will come back a year later, 2 years later, just to express their thanks. And we're amazed at how many of these patients that after we have seen them, and it might end up being, by the time we discharge them, it will be 3 months, 4 months, even later after their neurological event, after their stroke or their head trauma, and after we have discharged them, they continue to make progress. And so that's very rewarding to see them later. But during the whole process, I think Eddie put it well, the thing that is challenging is the most rewarding when they do learn to compensate for these drastic changes that have changed their life.
Sure.
And their confidence raises and their outlook, their affect improves. That's just very rewarding. And another positive thing about the lift, even though we're dealing with some very serious deficits, as Eddie said, some very life-changing deficits, that's tough stuff, that's heavy stuff. But the atmosphere at the lift is one of laughter. There is one of just smiles and encouragement. It's a very positive place. And I think there's a curative nature in that.
I think one thing unique too is just we try to see one patient at a time. And I think that's something unique to us because a lot of other clinics will double book people. Like let's say for an hour you might have 2 people.
Sure.
Well, when we have neurological patients, we are one-on-one that whole hour. And that's something unusual in the outpatient rehab setting. And so they get our one-on-one attention, each of us for an hour. So 3 hours straight of one-on-one with each of the therapists. And I think that's very unusual.
Yeah.
That's a big difference between us and other clinics, that one-on-one.
That's great.
We are allowed to see these patients for an hour, and we're old school as far as the time that we're allowed to spend with these patients. And I think that makes a big difference.
I'll say that is probably one of the great aspects of working at West Tennessee Healthcare. They allow us to spend that full hour with these neurologically involved patients. I haven't worked in another clinic, so I don't know. You may not get to do that in another place. but I know we get to do it here.
Yeah,
So
that's great.
Yeah, we are legit one-on-one, right by their side every minute of that hour, working with them, hands-on with something.
Mm-hmm.
I think that kind of proves the family atmosphere. You know, if you're going to work with somebody one-on-one for an hour, you're naturally going to develop some sort of relationship with that patient. More so, again, than just, all right, what's wrong with you, and let's get you out the door. You know,
Yeah.
get the next one in.
Right.
No, I think it's great that you guys are doing that.
You know, and I think another thing to speak about the lift is that it's just a cool facility. I mean, it's big, and you need to come take a tour.
Yeah, we have a really cool program that when we get finished with our patients, we have an exercises medicine program where they can actually go next door and join the fitness aspect of it, and the enrollment fee is waived. And we collaborate with the exercise specialists over there on, this is what we were working on at discharge, this is what they need to continue to work on. And so that exercise specialist will see them 3 times a week. They'll do an assessment the first day and just kind of show them around the equipment so that they can continue at a higher level than just at home, because there's a lot of things
Sure.
you can't do at home if you don't have the equipment.
Right, sure.
And so, what is it, 3 months? What's the
2
cost? There's a
months.
discounted rate.
It's $60 for 60 days.
$60 for 60 days, which is a discounted rate for what the gym normally is. But it's a great program for them to continue to get stronger. Their insurance might make us discharge them earlier than we wanted to. And then they can go next door and continue to work on those exercises with one of the specialists over there. So that's a good aspect of coming to the lift for their
I
treatment
believe
too.
there's also a nutritional assessment or a dietary assessment with that if they choose to do that. So
I think it's great that the lift, I mean, people might see the lift advertised or drive by it, and initially their brain might go to, oh, yeah, you can go work out there. But it's so much more than that. That can, like you said, kind of include the workout aspect after you guys finish your normal, like, 2 months of therapy or 3 months of therapy or whatever. So I'm just saying, I think it's great that it's all just one big thing as opposed to a gym, a therapy, a clinic. It's all kind of encompassed into one thing. I think it's amazing. Well, this has been really great information to have. Thank y'all so much for coming in today. Listeners, if you guys are listening and you want to check out the lift in downtown Jackson, I've put their link to their website in the description of the podcast. And like I said, this has been great. Thank you guys so much for coming in today. And this has been another episode of We Talk Health.